is male circumcision ethical? Wait! Don't click away. We know this sounds weird, but it's important. Please hear us out. Let's really think about this. First of all, what is ethics? Ethics is a branch of philosophy that deals with defending and justifying or disproving moral issues and questioning what's right and wrong. To begin answering the question of the ethics of circumcision, we need to consider the reasons behind circumcisions. They are primarily for cosmetic, religious, and medical reasons. There are health benefits that come with circumcision. One reason is that hygiene is made easier. Circumcision is the removal of the foreskin, which makes the penis easier to clean and decreases the surface area for bacteria to grow on. According to the American Academy of Pediatrics, circumcision has also been associated with a decreased risk of urinary tract infections and a decreased risk of sexually transmitted infections. It is also associated with prevention of penile problems and a decreased risk of penile cancer. A religion-related reason is that male circumcision is in accordance with many religious beliefs, as it is part of the Mosaic Law or the Law of Moses. Now that the reasons for circumcision have been addressed, the question remains, is male circumcision ethical? Female circumcision has been illegal in the United States since 1996 and is referred to as female genital mutilation rather than female circumcision. Why is it that one has been outlawed and called mutilation and the other has not? The main reason is that male circumcision comes with a lot of health benefits and female genital mutilation does not. This brings up a new question. Do the benefits of circumcision outweigh the risks and/or costs? This is an example of a consequentialist way of looking at ethics. Consequentialism is the belief that the morality or ethicality of an action is decided entirely based upon the outcomes of that action. Not all outcomes are positive, though. The outcomes or consequences of circumcision are the health benefits and the negative outcomes. These risks include the foreskin accidentally being cut too short or too long, the foreskin may not heal properly after the procedure, and there is a chance that the remaining foreskin will reattach to the end of the penis, resulting in the need for a minor surgery to repair it. These negative outcomes are rare and minor, meaning they don't outweigh the benefits. According to consequentialism, does this justify the ethicality of circumcision? Well, yes, but that's not enough to justify it entirely. The consequentialist justification pyramid is a tool that can be used to decide whether or not the mere consequences of an action are enough to justify the ethicality of that action. The consequences of circumcision are only the most basic tier of the consequentialist justification pyramid. It is set up similarly to Maslow's hierarchy of needs. The benefit and risks of circumcision are on the bottom tier of the pyramid. The avoidance of pain to the child is on the second tier. Parental consent is on the third tier. And finally, religious freedom is on the uppermost tier. The tiers are in this order because, when looking at it from a consequentialist point of view, it is important to first and foremost address whether or not the benefits of circumcision outweigh the risks. Then, it must be determined if the child should be made to endure the pain or not, after which consent from the parents needs to be considered. And finally, the freedom to practice religion must be addressed. The pain that the procedure will inflict on the child holds greater ethical importance than the benefits that it could potentially bring about. A pediatric physician named Paul Fleiss, who after performing his first circumcision and hearing the child crying in pain, resolved to never perform another circumcision again. The procedure can last anywhere from 6 to 40 minutes. Is it ethical to put an infant through an essentially unnecessary surgery that could last up to 40 minutes? Well, the consequentialist would say that it is ethical if the benefits of the procedure outweigh the risk, which, as it has been determined, they do. However, it still feels wrong to allow an infant to endure pain. This can be explained through the lens of hedonism. Hedonism is the ethical theory that the highest degree of good that humanity can attain is pursuing pleasure and feeling satisfied. If this is the highest good that humans can achieve, then pain is the highest degree of bad humans can achieve. So it can reasonably be determined that circumcision is only ethical if anesthetics are used to minimize the pain that the child must withstand, and so long as the benefits outweigh the risks. This constitutes the second tier of the pyramid. The third tier of our pyramid is parental consent. Circumcision would not be permissible if the procedure were to be performed on a child without the consent of both parents. John Locke said that if one puts work into something, that thing becomes their property, in part or in whole, and because the parents put work into making the child, they should have the final say in the decision. They must also be informed of the risks of circumcision so that they will have the ability to make an informed decision that is in the best interest of their child. Because of this, we can easily say that circumcision can only be ethical if parental consent is given, the use of anesthetics is employed, and the benefits of the procedure outweigh the risks or costs. The uppermost and final tier of the pyramid has entirely to do with religious freedom. Because of the religious beliefs behind the practice of circumcision, it would almost seem unethical to outlaw circumcision because that would be limiting religious freedom. Of course, not all religious beliefs are ethical or legal. Some religious beliefs can be overridden if they are deemed unethical. However, so long as circumcision meets the requirements of each tier of the consequentialist justification pyramid, justifying and defending the ethicality of circumcision is possible. The benefits of circumcision outweigh the risks and costs. Anesthesia may be used during the procedure, and so long as informed parental consent is given for the procedure, it can safely be said that the practice of male circumcision is ethical and can permissibly remain legal. Thank you for watching. you.